Hello and welcome. I'm Kenzie.
And I'm Carli, and this is Ask a Therapist.
Each week, we explore life's most relatable questions, from relationships and boundaries to burnout and self-worth, all through a therapist's lens.
We're licensed therapists, but this isn't therapy. It's a place for insight, reflection, and a little humor along the way.
Your questions,
our insights.
Ask a Therapist. This podcast is intended for entertainment and educational purposes only. The content shared should not be considered a substitute for professional mental health care, diagnosis, or treatment. We strongly encourage listeners to seek help from a licensed mental health professional for any personal or psychological concerns.
Any advice or commentary offered is based solely on the information provided. As such, we cannot guarantee any specific outcomes, and the feedback given should not be interpreted as professional mental health advice. If you are experiencing a mental health crisis, please call 911, 988, or 211. Hello, everyone. Welcome to episode 1 of Ask a Therapist. Woohoo!
Woohoo!
You've got Carli and Kenzie here, and we are going to kick off with an icebreaker question just so that you can get to know us a little better. And so, Kenzie, I'm going to ask you, why did you choose to become a therapist?
I love that question. I knew that I wanted to work with people. I knew that I wanted to do something I genuinely love, meeting people, getting to know people. And so when I was a senior in high school, I decided that I was going to become a nurse. And so I took AP biology and human anatomy, and I kind of had my track going in that way. And then I failed those classes and figured out that I was really not super talented in the science department. And so I really didn't know what I was going to do, what I wanted to do. But I had always worked with people. I had always enjoyed just getting to know people, knowing their stories. And the first time that I ever went to therapy myself, I just knew immediately that this is what I wanted to do with the rest of my life. And I feel so lucky and so grateful to be in this position, to be a therapist, to get to know people and hold their stories with them. What about you?
Yeah, that is interesting. Well, similarly, I was also inspired by my first experience in therapy. But for me, it was kind of in a different way. Like I did some premarital couples therapy, and not that I was, I was a bit underwhelmed. And I was kind of like, I could totally do this and do way better. That was my thought process, if I'm honest. And I kind of fought it a little bit. I didn't really want to be a therapist. I didn't necessarily want to be in a helping profession at all, even though it is very much aligned with like my personality. I think I rejected it a little bit. I was working in like fundraising and development. I kind of had an impression that, being a therapist meant committing to a life of poverty. not really, like just the type of career that I envisioned for myself. But when I was honest with myself about what I'm good at and what I'm interested in, talking about relationships, people, human interactions, things that, it's just what I enjoy. It's what I'm most interested in. It's the type of shows and movies that I want to watch. It's what my friends most call me for advice for and things like that. And so I kind of backed my way into it and saying like, I think I would be well suited for this, and decided to go to school for it. So I'm glad I'm here. I've gotten plenty of moments of confirmation that I'm in the right lane for myself. So that was my journey toward becoming a therapist.
I couldn't agree with that part more about, enjoying it, like enjoying reading about it, enjoying learning about it. As forementioned, was clearly not good at science or even super interested in it, but I loved psychology. Like I loved learning about people and relationships and experiences. And I think that when you're in the profession, in the field, like it calls to you. It gets you where you're supposed to be, where you want to be, and you just have that feeling of kind of knowing.
Agreed. Definitely agreed.
Well, we're really going to put our knowledge to the test here with this podcast. but I think that we're both excited about this experience and being able to do something creative with this profession, to be able to put this out there for hopefully a broader range of people. And we're super excited. We had a bunch of people submit questions to us for our first season of Ask a Therapist. So we went through them and decided that we wanted to start with this first question, just because we think that it is super relatable. I think it's a good way to kind of start this podcast off. So, um, okay, Carly, are we ready?
I'm ready.
All right. So, our first question comes from a 32-year-old female who is looking for advice on their current low self esteem. They noted that it has impacted both their personal and professional life, saying, quote, when it comes to dating or lack of dating, I feel a lot of fear around it and someone not being interested in me. Professionally, I've received feedback on how I need to be more confident when presenting or speaking to partners, and I'm tired of being undervalued because of it. How can I grow from my current low self esteem? Carly,
Hmm.
what are your initial thoughts on this question?
Yes, first, very relatable question, I think. I think there are a lot of people who struggle with self-confidence, and sometimes you become aware of it because of either the opportunities that you miss or the ones that you don't take, the things
Sure.
that you just don't even try. And so when I was thinking about this question, one of the first things that came to mind was the concept of confidence versus self-esteem. And then I know she didn't mention self-worth, but like how self-worth fits in there. And I do think although all three of them are related, they're different. And so I find myself being curious about like which one she feels most challenged by, because I do think there can be a different approach depending on where the real struggle is. So,
Yeah.
when I'm thinking about confidence, people often think that confidence is built through like success and achievement and accomplishments. And of course, anything that you are accomplished in, there's a good chance that you probably feel pretty confident about it.
Right.
Um,
Right.
but confidence is really built through surviving failure. It's through the resilience of I
Yeah.
messed up and I know that I can get back up and do better.
Sure.
And so when I think about ways to build confidence, I don't know that you can do that without trying and sometimes failing and then seeing, you kind of stand up, you dust yourself off and you're like, okay, I'm still here, I can do
Yeah.
this.
Yeah.
So when I think about building confidence, especially say in the workplace, like she mentioned, I'm thinking about opportunities to like build her training and her competence. Right.
Sure.
So, are there opportunities to like seek out some sort of training, schooling, mentorship, things of that nature so that she can feel more confident in her work? Right. I'm kind of wondering if that lack of confidence just has to do with maybe she doesn't know certain things or isn't
Sure.
confident in her ability to try and survive. So I think that this is one of those things that you got to try, you got to be willing to take risks,
Uh-huh.
and it's on the other side of that you start to build
Yes.
more confidence. And that is
Yeah.
rooted, I want to give credit where it's due, that is rooted in the growth mindset concept,
Sure.
which there's a book called Mindset by I believe it's Dr. Carol Dweck, where she talks about a fixed mindset versus a growth mindset. And so
Yeah.
a growth mindset, like at the basics, is just the belief that we can develop our skills through practice.
Yeah.
They're not fixed. And
Yeah.
so that's what I would offer as it relates to confidence.
Yeah.
Any thoughts
Totally.
there? But I have a little bit more, but before we like continue.
Sure, sure. Well, I think that your how you described the self-worth, the confidence, like the difference and the discrepancy in those words is so interesting because I think even just as I was taking notes on this question, I was probably using them interchangeably.
Hmm.
Um, but what you said about the confidence was something that really kind of stood out for me. And I think that just quickly give some like insight into low self-esteem. Like low self-esteem is not a character flaw. This isn't because you're weak. This isn't because, there's something wrong with you. It's really like a learned protective response over time, right? Like
Hmm.
there is this idea of removing ourselves, making ourselves smaller to protect ourselves if we have felt discomfort or unsafe in the past in ways that maybe we've put ourselves out there. So if in this case, if there was a rejection when dating, or if there was an embarrassment when presenting or talking to partners, that's a painful experience. And so that automatic association in our head is going to be like, heck no, I'm not doing that again. Like, that was scary. That was hard. I'm not good at that. People don't like me in this. Like, we're going to try to make those automatic kind of connections, and that keeps us safe. And that thought process then gets reinforced over time, which then leads to that low self-esteem. So um, it's not because there is anything wrong with you. It's really just your brain and your mind trying to help you, to protect you. But something that I did write down again to that confidence piece is that confidence isn't a personality trait. It's not something you have or don't have. Exactly kind of what you were saying, Carly. If it's a skill that you can build. So putting
Yes.
yourself out there, having your like doing something that feels scary, that feels hard, recognizing, okay, this feels scary and hard because my brain is trying to protect me, but I'm showing up for myself anyways. I'm going to push myself out there and do this thing because I know that I want more, because I know that this low self-esteem, this thing that I'm holding on to protect me really isn't serving me anymore, and I want more for myself.
Mhm, mhm. No, I think what you're saying about the low self-esteem, is spot on because, uh, oftentimes, like, it can be that can be a trauma response, and I'm sure throughout the course of this podcast, we'll talk about this more often. Because there are plenty of scenarios where people have adopted habits that maybe serve them at one time, or maybe
Yes.
they perceive as protecting them, and really
Yep.
it's holding them back from growth. It's like preventing them from taking that
Yep.
step forward that would actually lead to change. So I think that's a
Right.
very common thing. When I think about self-esteem and self-worth and how it differs
Mhm.
a little bit from confidence,
Yeah.
I think self-esteem is kind of like how you feel about yourself. It's almost like your judgment
Sure.
or your opinions of yourself.
Okay.
So like, am I a good person? Do I trust myself?
Sure.
Do I essentially show up for myself? Like, how do I feel about my decisions? Like,
Sure.
so we can all find ourselves judging ourselves based on our impression of maybe what we should or could do, the chances that we did or did not take. And
Uh-huh.
then when I think about self-worth, that to me speaks more to like your perception of your just inherent value, just like
Sure.
being a human being, kind of like,
Sure.
am I enough?
Sure.
And so when I break that down, I'm like, okay, so my self-worth is, am I enough?
Sure.
My self-esteem is how I feel about myself. Like, essentially, do I
Okay.
like myself? Do I respect
Okay.
myself?
Sure.
And then my confidence is like, how do I feel about my abilities? What am I capable of? What do I believe
Sure.
I can or cannot accomplish?
Sure.
I think when we think about it in like those tiers, confidence,
Mhm.
at least from my perspective, is probably one of the easiest to work on because it's just a matter of like trying and developing a skill. Not to say
Sure.
that there's not challenge with that, right? But like,
Yep.
there's a we can define how we can tackle that.
Sure.
Self-esteem can be a little more challenging because now we're getting into like, well, why do you think you're making decisions that you don't respect? Or why do
Yep.
you not
Sure.
like yourself, right? What are you
Sure.
doing or not doing that
Sure.
gives you this impression that you are in some way like not living up to your own expectations?
Sure.
So that can be a little more challenging. When I think about self-worth, I think that is probably the most challenging to
Sure.
combat because
Sure.
oftentimes it is somewhat programmed by our early experiences. I do think that touches a little bit on attachment, which,
Sure.
we probably won't go into today, but kind of like those early experiences and messages that we get about our own value. I think that, that touches on our self worth. And that is something that if this particular listener is struggling with just her sense of being enough and being
Sure.
worthy, I think that's something to probably consider tackling in therapy.
Sure. Sure. Would you recommend somebody kind of like essentially taking a look at those 3 different tiers, saying like, "Okay, where am I at confidence-wise? Where am I at self-esteem-wise? Where am I at self-worth-wise? Why are those thoughts and feelings come up? Like, maybe am I stronger in one area than another? Why is that? What kind of evidence do I have essentially to make me feel a certain way in one of these tiers?" And then kind of process through that. And can they then go through steps? Can they kind of build that confidence and then help build that self-esteem? And then, maybe that gives them enough of a foundation to then tackle that self-worth piece.
Yes, I think by breaking it down and really getting clear on where you're feeling stuck, it's going to help you figure out what you need to do to change it. Right?
Sure.
So it because, if the true issue is self-worth and we're trying to fix it by building your confidence, we're going to push you to like take risks and try things and get better, but if at the
Mhm.
core you don't believe that
Yeah.
just inherently you're like worthy, then
Sure.
we're never going to quite like scratch that surface. You know what I
Yeah.
mean? So I think it helps us to better target how to tackle the problem once we kind of parse out, okay, where is
Sure.
this actually coming from? Sometimes people have pretty decent self-worth, like they believe that human beings in general are valuable and like,
Sure.
they're worthy of love or respect, but they may not have a lot of self-esteem, meaning like they just don't feel like they're doing a good job of
Sure.
like living up to that. You know what I mean?
Sure.
So I think
Sure.
depending on where identifying your strengths can really help to build like, okay, I'm actually doing pretty good in this area. I just need to focus on my confidence, or I just need to focus
Sure.
on my self-esteem. And we can also pull from those strengths. Like if you do have a good amount
Mhm.
of confidence in something that you've done before, maybe you
Mhm.
played a sport or an instrument, then we can pull from that. How did you build that confidence? How did you get
Yeah.
there? Right? What did you
Yeah.
do when you weren't feeling as confident? So I
Yep.
think by asking yourself some of those questions, we can really help to like narrow down how to best address it.
Yeah. No, I love that. I'm thinking about how you kind of touched on, like, some childhood experiences, right? And so that self-worth piece can be really tied to just, um, essentially how you have grown to see yourself in the world. What would you say to listeners who are like, "Shoot, like, okay, what does that mean? Like, what do what do I do? Can I essentially rebuild my self-worth even if I had these really difficult experiences in childhood?" What would, your thoughts or suggestions be there?
Yes. Well, I am also interested to hear how you tackle this, but I think this is a common thing that comes up in therapy. And it can
Yeah.
be really discouraging if you kind of stop there and you're just like, well, this is, kind of how I was programmed and I can't change it. I don't believe that.
Mhm.
But it does require that you challenge some almost innate beliefs, and sometimes that shows up in your self talk. And so
Sure.
oftentimes what I'm going to do is have a client really look at how they speak to themselves,
Mhm.
and try to like parse out what is in therapy we would call it their signature theme. Like what is that theme that it kind of permeates through all of these situations? What's that core belief? And oftentimes it's something to the effect of I'm not enough, I'm not
Mhm.
worthy, I'm not
Mhm.
lovable,
Yeah.
I'm not fixable, I'm damaged, things like that. And so,
Yeah.
once we realize that that's what's at the core, then, we can start to challenge it when it shows up. So,
Right.
you have an
Yeah.
experience, this belief kind of comes up. We start to see it maybe in your self talk or in the way that you behave. And then we
Sure.
can counter it with, some truths that maybe we can both agree on. We can look for ways to like, we can look for evidence to the
Yeah.
contrary, right? So
Yeah.
you may
Yeah.
feel that way, but feelings aren't facts. What are the facts that we can
Yeah.
actually use to kind of counter what you may be perceiving as truth? So I
Yeah.
think it's a bit of a slow process. It requires a
Sure.
lot of trust building, and
Sure.
it kind of takes time, I think, to unravel that with
Right.
clients. So that's how I like to approach it. But I'm very curious to know how you do that.
I think everything that you said is absolutely just such an important part of that process. As you were talking about that, I just kept thinking about too, um, there's something called like the narrative view in therapy. And this is something that Carly, you have talked about before, and I have loved kind of hearing you explain it. But I'm thinking about how, if you have this kind of just internal belief, this negative sense of self-worth, how that can shape how you see your interactions in the world, how you see yourself, how you see different experiences that happen to you. And so, subconsciously you might be internalizing messages of, and noticing some of these things more of kind of like every time I talk, people look down at their phone. They don't care what I have to say, but you're really paying attention to those people more so than the people that are super engaged or the people that are nodding their head and enjoying that because maybe that's that belief that you have about yourself. So you're going to notice that more. And so I think about that a lot with the self-worth piece, exactly what you were saying of just kind of like, let's get there, let's figure out what it is, let's try to find some evidence to the contrary, and also expand that worldview a little bit. Like, okay, how have I been seeing myself in the world? How have I been seeing my experiences, how people see me? And is that the full truth, or is that just kind of what I've been conditioned to see? And so kind of opening up that lens a little bit too, so that it doesn't, because I think a lot of times with self-worth, it's like, oh, this really feels like the truth. This feels
Mhm.
like what is real. And it can be a little jarring to like test test that, right? And so I think that um you're absolutely right about the trust piece too, having a therapist that you can work with and really help you get there and help you see yourself differently because that's a part of what I love about therapy is just kind of holding the mirror up to clients so that they can see themselves in the way that we see them.
100%. And, building that trust allows you to challenge clients, but hopefully without invalidating their experience. Like, we
Yep.
don't want to send the
Yep.
message that this is not real and you're just making this up. So you need to just get over it. Right.
Yeah.
Like,
Yeah.
everything that you're saying about narrative, I tend to work from a narrative perspective. So I'm
Sure.
100% on board with that.
Yep.
And I really believe like it's not just what we experience, it's what we tell ourselves about those experiences and kind of the meaning
Yep.
that we draw from them. And that's why you could have two people that have very similar experiences, two people maybe that experience
Yeah.
trauma, and one can like walk away and you know be very resilient and kind of be able to move on from it and heal from it, and for someone else they may carry that for the rest of their lives.
Yeah.
And so I think part of that therapeutic relationship and that bond is like building enough trust that the person is open to hearing you potentially challenge the narrative that they've formed about
Yeah.
who they are, the meaning
Yeah.
that they've made from it, because that is kind of getting into what we believe about ourselves. And
Yep.
most of the time, I mean, we think who could tell us more about ourselves than us, right? Like,
Right.
but the
Right.
truth is that we have a particular perspective. And sometimes if
Sure.
we're just open to seeing it from a different angle, there's more there than we may be
Yeah.
acknowledging.
Yeah.
Yeah.
Well, and I like that the different angle piece too, and this is something that I was thinking about, if we're talking about what are some practical skills that we can give this listener when they're asking about what do I do with my low self-esteem? Like what do I do with how I'm feeling about myself right now? And one of the ways and kind of what we're talking about a little bit is reframing. So some of those automatic thoughts, can we reframe those to curious thoughts? So instead of it
Mhm.
being like no one's ever going to want to date me or everybody at work thinks I'm not good enough. Can this person instead say, what is this feeling trying to protect me from? What am I scared of? What's coming up for me right now? When you notice those automatic thoughts, can you shift it and get curious with yourself? And I think that
Mhm.
that can be applied to those feelings of self-worth too. What am I really feeling? What's coming up for me? Um, Getting curious and really paying attention to yourself, I think is can be really helpful in this situation.
I love that. I love transitioning toward curiosity, rather than judgment, because I think in most instances, whether we realize it or not, we can form very swift judgments about what something
Mhm.
means, and
Yeah.
so just to pause and kind of ask, like, what am I getting at here? What am I
Yeah.
trying to avoid? I think that's a great way to just challenge some of those negative thoughts and negative beliefs.
Yeah.
Um, I also think, to the points that we were both making earlier, I think trying, like literally taking the risk
Yeah,
of trying. And
yeah,
yes, sometimes, particularly in dating, like you're going to fall flat sometimes. Like, not
yeah,
everyone is a connection. Not everyone's going to be,
yep,
your forever person. And
yep,
so, like, being okay with the idea that this is just a coffee date, or this is
yeah,
just, a first conversation,
yeah,
and it may not be great, but at least I
right,
can, at the worst case scenario, I can count that particular person out, and like I'm on to potentially find my next person. I think we're
yes,
going to have to take some risks and be okay with the fact that it's not going to be perfect. But
yeah.
on the other side of trying and taking that risk could potentially be the outcome that you're looking for. So,
Oh, yes, 100%. I think that to that point and kind of, I know that I was saying earlier of like this understanding of where this comes from. It's a protective way of just trying to keep you safe. There is such an importance of understanding that so that you can also take on that compassionate lens with yourself. And so
yes.
you can say like this is I understand why I'm so nervous and why I'm so scared and why this is so hard. I get that. I see that. I'm just trying to keep myself safe and I can do this anyways. And then so right, if you go into a date and it doesn't work, instead of saying, I knew it, nobody's ever going to love me, this is not going to work, instead you say, that was really hard. That was really scary. And I'm so proud of myself. That was so brave. And, or even just, this is a part of the process. And I am taking one step closer into being the version of myself that I want to be. And I'm proud of myself for that. Like, I did it. It didn't go the way I wanted to. That's not because this is never going to work and it's just never um I'm never going to be that person. This is me putting one foot in front of the other, taking that next step and showing up. And I think that compassionate lens with yourself is a really important part of this too.
100%. And I think learning to do that is a bit of a skill, like
Yeah,
learning to
yeah,
have that
yep.
self compassion, because I think for some people, it's very hard to do that and not feel like you're lying to yourself, or
Yeah,
blowing
sure,
smoke or
sure.
whatever. So
Yep.
to be honest, in therapy, we might call it like rolling with the resistance, in terms of like, yeah, of course, I'm not confident in this. I haven't practiced
Right.
it. So,
Yeah,
it's kind of like just
yeah,
ignore, we don't have to
right.
be dishonest. We can say, like, yeah,
Yeah,
of course I'm not confident. I haven't practiced this. I'm not
right.
very good at it, but I'm taking one step closer to getting better. Right. And so,
Yes,
like,
yes.
sometimes that's
Yeah,
all the truth that we need. It doesn't have to
yep,
be flowers and rainbows and, all of that.
yep.
It's just a matter of acknowledging, like, yes, this may be where I am right now. And
Mhm.
I am empowered to change that if I want. And I'm making a choice to take a step in that direction. And I
Yes.
think being able to like pause and acknowledge that is a great first step in building that
Yeah,
confidence. Yeah.
yeah. And I just wanna, shout out this listener and this submission,
Yes.
too, because I think, to me, this question it's just such a testament to the love that they have for themselves. Like, the fact to even submit a question and say, I want to acknowledge this. I wanna change this. I want something different for myself in my life. I just think that that's such a testament to the start, to how much you love yourself, to how much you care about yourself. This pattern that you're in is no longer working for you, and so wanting something different, wanting to push yourself is really brave. And I think just remembering like progress over perfection, small daily changes, like exactly what you were saying, just taking that next step, just pushing yourself a little bit more. You're building a skill, and that's huge.
Agreed, and the self-awareness, right?
Yeah.
Because it is very easy to blame others, right? I didn't
Yeah.
get that promotion because something or someone's working against me, or
Purpose,
it's
yeah.
just that the dating pool has pee in it and there's no good
Yeah,
options out there. It is
right,
very easy to blame others as opposed to saying,
totally.
I think I might be getting in my own way, right? So just the
Yeah,
awareness to say, I might be a contributing factor here. I agree. I think that
right.
speaks volumes, and it gives us something to work with, because now, like, we can't control others, but if you're willing to look at the things that you're doing, then yeah, we can absolutely work with that.
Yes, yes, absolutely. Do you have any final thoughts? Like, what were some things that came up for you in this that you still want to, make sure that that we share with the listeners?
Yeah, honestly, I think we covered most of it. I do kind of want to normalize this challenge, especially,
Yeah.
a female listener at the age of 32. Like, I think this is that you're kind of like getting into the groove of your career, but maybe still not as seasoned as some of the, senior members in your profession. I also think about just the age demographic in terms of marriage and kids and like all the
Yeah.
pressure that comes with that. So to just
Yeah.
kind of normalize that you're not the only one questioning, is it me? Like, why don't I have this confidence in myself?
Yeah.
But the willingness to ask the question, I think, is the start, and
Yeah.
really just some encouragement that it doesn't have to stay this way. So I kind of just want to encourage her that this is something that's worth working to change.
I think that's such a perfect wrap up for this. I think that it's so important for this listener and for others to hear that too. And so I think that I 100% echo everything that you just said.
Fair enough. I think we did it, Kinsey. I think this is our first
Oh
episode.
my gosh! Wow, we did it! This is so exciting.
Hopefully, you all will stick around. We've got lots more questions, and we are so grateful to the people who are kind of kicking us off with some questions and have been brave. So, we'd love you to join us for another episode, another question. But for now, I think we're signing off.
All right, we will talk to you next week. Bye.
Bye.
That's it for today's episode. We hope it gave you something to reflect on, or maybe even that aha moment.
If so, you know the drill. Rate, review, subscribe, and don't forget to text it to the group chat. Remember, sharing is caring.
Got a question you want us to tackle? Big or small, we want to hear it.
Email us or slide into our DMs on Instagram at askatherapist_pod.
You bring the questions.
We'll bring the insight and probably a metaphor or two.
This is Ask a Therapist.
See you next time.